What is cerebral palsy? The definition of cerebral palsy, also called CP, is a collection of disorders caused by abnormal brain development or damage to the brain around the time of birth or early in life. Cerebral palsy is a motor disability, meaning it affects a person's ability to move and maintain balance and posture.
When a person and a family hears that information for the first time, that can be devastating. Then from there, it's time to kind of pick up the pieces and say, okay, this is the situation. Now what are we going to do about that? So when families come to see me or me as part of a multidisciplinary clinic, then we can say, okay, you know that you have cerebral palsy. Let's make sure that you understand what cerebral palsy means.
What causes cerebral palsy? Some causes of cerebral palsy include bleeding in the brain, infections of the brain, including meningitis or encephalitis, seizures at birth or in the first month, certain genetic conditions. In some cases, healthcare providers are unable to determine the cause of a child's cerebral palsy.
In the beginning, cerebral palsy is diagnosed primarily based on the physical findings, but we know that cerebral palsy is a diagnosis that relates to some problem with the brain and some injury that happened to the brain or some abnormality with or difference in how the brain was formed.
CP is a permanent condition, but it's not progressive. That means that the brain damage can't be reversed, but it won't get worse. But abnormal muscle tone or motor control can shorten muscles and deform bones. Early intervention and appropriate treatment can help ease symptoms and improve a child's abilities.
The injury that occurs early in life can cause effects on many different functions for the person. So that could be communication, it could be eating, it could be their mobility, it could be problems with seizures, learning. So all of those things can be present, or maybe only a few of them.
An average of 1 in 323 children in the U.S. have CP, making it the most common motor disability in childhood.
You take a patient that has a mild form of cerebral palsy, if we were just to say, oh, your child has cerebral palsy, a lot of times they think that their child's going to be sitting in a bed when they're an adult and not be able to do anything for themselves. And so when you counsel a family about a diagnosis and a disability, you need to anticipate what their thoughts and feelings are so that you can kind of counsel them and not overburden them or overworrying them and be as accurate as you can.
Types of cerebral palsy. There are different types of cerebral palsy depending on which part of the brain is affected. A person can have mild cerebral palsy or may have a more complex form. Spastic cerebral palsy is caused by damage to the cerebral cortex. It causes stiff muscles, also called spasticity. It's the most common form of CP.
Spasticity or tone in the context of cerebral palsy takes the form of tightness in the muscles that can interfere with functions such as walking, can cause pain, and can eventually cause orthopedic deformities.
Spastic cerebral palsy can affect different parts of the body. When it affects the legs more than the arms, it's called diplegic cerebral palsy. Spastic cerebral palsy that affects only one side of the body is called hemiplegic cerebral palsy. In most children, the arm is more affected than the leg. Spastic cerebral palsy that affects the entire body is called quadriplegic cerebral palsy.
When we treat children with cerebral palsy, we try to analyze, what the issues are. And so with cerebral palsy, spasticity is one big issue, weakness is another big issue.
Another form of CP is called dyskinetic cerebral palsy. Dyskinetic cerebral palsy is caused by damage to the basal ganglia, which causes uncontrollable movements. Damage to the cerebellum causes a form of CP called ataxic cerebral palsy. Ataxic cerebral palsy causes poor balance and problems with coordination. Mixed cerebral palsy is a combination of two or more types. It's associated with damage to multiple areas of the brain.
One of my jobs as a neurologist and taking care of children with cerebral palsy is doing my best to understand why a child has cerebral palsy. I can help the family understand what is going on with their child now and what things to look for in the future.